All right, so we're diving into urinary retention and BPH today. Looks like we've got a pretty good mix of stuff to go through, huh? Medical notes, some textbook stuff, even some memory tricks.
Yeah, definitely looks like someone's been doing their homework.
That's right. And that's why we're here to help break it all down, right? Make
Hmm.
sure we can pull out all the key insights. So maybe we can start with the basics. What exactly are urinary retention and BPH? I mean, beyond just the simple definitions.
Yeah, for sure. So urinary retention, basically, it's when you can't fully empty your bladder. And there's a bunch of reasons why that might happen. And BPH, benign prostatic hyperplasia, that's one of those reasons. It's when your prostate gets bigger,
And
enlarges.
that's where that memory trick, big prostate holds back urine, comes in, right?
Exactly. It's all about location, location, location. The prostate, when it gets bigger, it ends up pressing on the urethra. And, well, that's the tube that carries urine out. So you can see how that caused problems.
Makes sense. So those are the mechanics of it. But what about symptoms? The notes mention a whole bunch.
Yeah, so symptoms, well, they can be all over the place. And how bad they are, that usually depends on how severe the whole thing is. But some common ones you see are like feeling like you can't fully empty your bladder, having to pee all the time, especially at night. That's the nocturia thing. And then there's trouble starting to pee or having a weak stream that kind of starts and stops. I mean, this stuff can really mess with your life.
Definitely sounds like it. So let's say someone's having these symptoms and goes to their doctor. What are their options, treatment-wise?
Well, there are a few different ways to go about it. It really depends on what's causing the problem and how bad the symptoms are. But usually, medication is the first thing they try.
And I see here in the notes you sent, there are three meds, specifically. Bethanical, terazosin and
Yeah.
tamsulosin, and then finasteride. And you've even got some memory tricks for each one.
Those memory tricks, man, they really work. So, Bethanical, that one's mainly for neurogenic bladder. That's when the bladder muscles are weak because of nerve problems. And the trick, Bethanical bladder control, pretty much sums it up, right?
Straight to the point. Now, we've got terazosin and tamsulosin, each with their own set of tricks, too. You've really thought this through.
Gotta find what works, right? So, both of these are alpha blockers. They help with urinary retention from BPH. They basically relax the muscles in the bladder and prostate so the urine can flow better. The memory tricks, they point that out, but also some important stuff to watch out for.
Oh, yeah, like teragusin helps with urination, but then terazosin, slow position changes
Yeah.
because of that blood pressure drop, the dizziness risk, right? And then terralucin avoid blood pressure lowering drugs for the same reason. But grapefruit juice, surprisingly, that's okay with this one. That's a lot to remember.
Yeah, and these are just memory helpers, right? It's
Yeah.
always best to follow what your doctor says about any meds. Now, finasteride, that last one, it works a bit differently. It shrinks the prostate. It blocks a certain hormone that makes it grow.
And that's where the FUN ride on a horse trick comes in. Because if your prostate isn't swollen, riding wouldn't be painful, definitely memorable. But I'm also wondering, are there times when meds just aren't enough?
Absolutely. Sometimes meds don't quite cut it, or there might be complications. In those cases, surgery might be something to consider.
And the notes mention two procedures, TURP and prostatectomy. Can you break those down for us? And why would you choose one over the other?
Sure. So TURP, transurethral resection of the prostate, that's the less invasive one. They use a tool that goes in through the urethra and they remove a piece of the prostate. Prostatectomy, that's when they take the whole prostate gland out. So yeah, a bigger deal, but sometimes it's needed. Like if the prostate is really big or there's worry about cancer.
So it all comes down to the individual situation. Now, what happens after surgery? There's something here about a three-way Foley catheter.
Right. So usually after either procedure, they'll put in a three-way Foley catheter. It's for continuous bladder irrigation that helps with the bleeding, making sure things drain properly after surgery, and it stops clots from forming.
And the notes mention something about urine color changing during recovery. What should people expect to see, and when should they be concerned?
So right after surgery, bloody urine, that's normal. It's just part of healing. Within a day, it should lighten up, get a bit pinker. And by 36 hours, you might see small blood clots. That's okay. But anything bigger, or if it stays bright red, call your doctor right away.
So it's a gradual process. Anything else people should be on the lookout for during recovery?
For sure, you might have some, well, accidents, a bit of dribbling after they take the catheter out. That's pretty common, and it usually gets better as your bladder gets stronger. But if you have a lot of pain during irrigation, that could mean there's a blockage. You need to see doctor right away for that.
So UTIs, they're a big concern, right? And we touched on them a little earlier, but can you dig a little deeper?
Hmm.
The notes mentioned something about bacteria.
All right, so UTIs happen when bacteria, usually E. coli, get into your urinary tract and multiply. And when you have urinary retention, the bladder doesn't empty completely. It's like a perfect breeding ground for these bacteria. So the risk of infection, it goes way up.
Kind of like stagnant water,
Yeah.
right? Creates a perfect environment for bacteria to grow. What are the telltale signs of a UTI?
Well, the symptoms, they can be different for everyone. But, common things are like a burning feeling when you pee, having to go more often, and really urgently cloudy or smelly pee, even pain in your pelvis.
And what should you do if you have those symptoms?
Go see a doctor right away. Don't mess around with UTIs. Usually they'll give you antibiotics. They target the specific bacteria that's causing the trouble. And it's super important to take the whole course of antibiotics, even if you feel better before you're done. Otherwise, you risk antibiotic resistance.
Right, I've heard about that. If you stop the antibiotics too soon, the bacteria can get stronger, and then the next time you get an infection, it'll be harder to treat.
That's it. Antibiotic resistance, it's a real problem. That's why it's so important to do exactly what the doctor tells you.
So don't try to tough it out on your own with a UTI, right?
Mm-hmm.
Get it checked out. Now, are there any other complications apart from UTIs that we should know about?
UTIs are the most common, but there are others. You could get bladder stones, bladder damage, and even kidney damage if you leave it untreated for a long time.
Okay, that really highlights the importance of getting medical help if something feels off with your, well, peeing habits, right?
You got it. Early detection and getting the right treatment, that's the key to preventing these more serious problems.
So before we move on, I want to go back to something we talked about earlier, this possible link between BPH and male pattern baldness. You mentioned finasteride is used for both, which makes you think, right. Is there any research happening on that?
It's really interesting. We see the link, but we don't fully understand it. There are studies looking into it, and some think it might have something to do with hormones or even genetics. But yeah, we need more research to really get to the bottom of it.
It's definitely an area that needs more investigation.
Absolutely. And it just shows how complex the body is, right? And how things that seem completely separate can actually be connected in ways we don't expect.
Okay, so lots more to learn there. Now, I know we focused on conventional medicine, but are there any alternative or complementary approaches people use for BPH?
Yeah, there are a few things people try alongside their regular treatment. Acupuncture, for example. Some studies say it might help with urinary symptoms. It could be that it affects nerve signals or reduces inflammation.
So it's about looking at the whole picture and maybe combining different approaches, right?
Exactly. It's all about finding what works best for each person, of course, talking to their doctor about it.
Right. Having those open conversations with your doctor is crucial for making informed decisions about your health. So I'm curious, with all this info about BP prevention, urinary retention, is there anything that surprised you in your research? Anything you found particularly interesting?
What really struck me is how these conditions, they can really mess with your quality of life. We
Yeah.
talk about the physical symptoms, but it goes deeper than that. Think about the anxiety of never knowing when you'll need a bathroom or, the embarrassment of leaking. That can really hit your confidence, your social life.
That's a side we don't always hear about.
Yeah.
It's crucial to address those concerns too, not just the physical stuff.
Absolutely. And that's why it's so important to be open with your healthcare providers. Talking about these things can be hard for some people, but it's the first step to getting the right support, finding solutions that can make you feel better overall.
Right. It's about breaking down those barriers and encouraging honest conversations about, well, pee problems, right? Now, before we move on, I wanted to touch on something you mentioned earlier, pelvic floor exercises for bladder control. Tell me more about that. Are we talking Kegels here?
Kegels, that's a classic example. It's all about contracting and relaxing those muscles that support the bladder. And they can be so helpful for both men and women. Strengthening those muscles, it can improve bladder control, reduce leaks, and even, boost things in the bedroom.
So it's not just for people who are already having problems. It can be a preventative thing too.
Exactly. Just like any other muscle, right? The more you work it, the better it works. And there's lots of info out there to help people learn how to do Kegels correctly. Even physical therapists specialize in this stuff.
Okay, so be proactive. Keep those muscles strong. Now, as we wrap up this first part of our deep dive, what would you say is the most important thing for our listener to remember?
I think the biggest takeaway is to be aware and to act early. Pay attention to your body. Notice any changes in your peeing habits. And if anything seems off, don't wait, go see a doctor. These conditions, they're often very treatable, especially if you catch them early.
It's about taking charge of your health and not just, suffering in silence.
Exactly.
Well, I think we've covered a lot of ground here. From the basics of urinary retention and BPH to the treatments, the complications, and even the emotional side of it all. It's been really insightful.
It has. And I hope our listener understands these issues better now and feels more confident about taking care of their urinary health.
I'm sure they do. And if this deep dive has sparked your curiosity, don't stop here. Keep researching, keep asking questions, and keep those conversations open with your healthcare providers.
That's right. Knowledge is power, especially when it comes to your health. Stay informed, stay curious, and take good care of yourselves.
Well said. And on that note, we'll wrap up this first part of our deep dive. Stay tuned for part 2, where we'll delve even deeper into these fascinating topics.
Yeah, that's a really important point, and one people don't always think about. It's not just about treating the problem when it pops up, but can we do anything to prevent it in the first place?
Being proactive, right? So what can you do to keep things running smoothly down there?
Well, first things first, weight. Maintaining a healthy weight, that's a biggie. Studies show a pretty clear link between obesity and BPH and all the complications that come with it.
So all those healthy habits we hear about, eating right, exercising, that stuff actually helps with urinary health too.
Absolutely. When you're active regularly, it strengthens your pelvic floor muscles, which are key for bladder control. And what you eat matters too. A balanced diet with plenty of fruits, veggies, whole grains, that can do wonders for your prostate.
I see here the notes mention things like tomatoes, watermelon, green tea. Those are supposed to be good too, right?
Right. Those foods have compounds that might protect the prostate. Tomatoes, they're packed with lycopene, which is an antioxidant. And some research suggests it might lower the risk of BPH.
So it's not just about avoiding the bad stuff, but loading up on the good stuff too. What about hydration? Does that make a difference?
Oh, hydration is key. Drinking enough water, it helps flush out bacteria, keeps your urinary tract working like it should. Think of it like giving your pipes a good rinse.
I like that. So simple everyday habits can really make a difference in the long run. We've talked about prevention, but what happens when things do go wrong? What are some of the complications that can pop up with BPH and urinary retention?
One of the most common, and it can be a real pain, is UTIs, urinary tract infections.
We touched on UTIs earlier, but why are they so common with these conditions? The notes mention something about bacteria.
Right. So UTIs happen when bacteria, most often E. coli, get into the urinary tract and start multiplying. And when you have urinary retention where the bladder doesn't empty all the way, it's like, well, a perfect breeding ground for bacteria. So your chances of getting an infection, they skyrocket.
Makes sense. Like we were saying before, it's like stagnant water, right?
Mm.
The perfect environment for bacteria to take hold. So what are the red flags? How do you know if you have a UTI?
Well, the symptoms, they can be different for everyone, but some of the usual suspects are, that burning feeling when you pee, having to go more often and feeling like you really gotta go right now. Your pee might be cloudy or smell funky, and some people get pain in their pelvis.
So if you have any of those symptoms, what should you do?
See a doctor right away. Don't wait. Don't try to tough it out. They'll usually put you on antibiotics, which will target the specific bacteria causing the problem. And this is really important. Take the whole course of antibiotics, even if you start feeling better before you finish them all. Otherwise, you're setting yourself up for antibiotic resistance.
Right, like we talked about earlier. Stopping antibiotics too soon, that can make the bacteria tougher, and the next time you get an infection, it'll be harder to fight off.
Exactly. Antibiotic resistance is a serious issue, so it's crucial to follow your doctor's instructions to the letter.
So yeah, UTIs are nothing to mess around with. Get them checked out. Now, are there any other complications we should be aware of besides UTIs?
UTIs are definitely the most common, but there are others. Bladder stones, bladder damage, even kidney damage can happen if you let things go untreated for too long.
So it's really important to, pay attention to what's going on down there and get medical help if something seems off.
Couldn't agree more. Catching these problems early and getting the right treatment, that's the best way to prevent serious complications.
Okay, so before we move on, I want to circle back to something we were discussing earlier, the potential connection between BPH and male pattern baldness. We talk about how finasteride is used for both, which seems like more than a coincidence, right? Any research happening to see if they're actually related?
It's definitely intriguing, right? We see the link, but the why, that's still a bit of a mystery. There's research going on, and some theories point to hormones or genetics playing a role, but we need more studies to really nail down what's going on.
Definitely an area that needs more exploration.
For sure, it just goes to show how interconnected things are in the body, and how things that seem totally unrelated might actually have some common thread.
Right. Okay, so lots more to learn there. Now, I know we've focused on conventional medicine, but are there any alternative or complementary therapies that people use for BPH?
Yeah, some people explore different options alongside conventional treatments, acupuncture, for example. Some studies show it might help with urinary symptoms. It could be that it works by changing nerve signals or maybe by reducing inflammation.
So it's about looking at all the possibilities and finding what works best for the individual. Right.
Exactly. And of course, this should always be done in consultation with their doctor.
Absolutely. Open communication with your doctor is so important for making informed decisions about your health. So I'm curious, with all this information about BPH and urinary retention, did anything in your research really stand out to you? Anything that surprised you or that you found particularly interesting?
It's funny you should ask that because one thing that really hit me was just how much these conditions can impact a person's life. Not just physically, but emotionally and socially too.
Yeah, that's something we don't always talk about. The physical symptoms are one thing, but the emotional and social side of it can be just as tough.
It's true. I mean, imagine the stress of never knowing when you're going to have to run to the bathroom or the embarrassment of, having an accident. That can really affect your confidence, how you feel about yourself and how you interact with others.
Yeah, it's a hidden side of these conditions that we don't always hear about. So it's important to address that too, not just focus on the physical stuff.
Absolutely. And that's where it's so important to have a good relationship with your doctor, where you can really talk openly about these things. It might be uncomfortable at first, but it's the first step to getting the support you need and finding solutions that can improve your overall well-being.
Right, it's about breaking down those stigmas and encouraging people to be open about urinary health. Now, before we wrap up, I wanted to go back to something you mentioned earlier about pelvic floor exercises for bladder control.
Yeah.
Can you tell us a bit more about those? Are we talking about Kegels here?
Kegels, yeah, that's the classic example. They're all about contracting and relaxing the muscles that support your bladder, and they can be incredibly helpful for both men and women. Strengthening those muscles can really make a difference. Better bladder control, fewer leaks, and even some benefits in the bedroom, if you know what I
So
mean.
it's not just for people who are having problems. It can be a good preventative measure too.
Exactly. Think of it like any other muscle in your body. The more you work it out, the stronger it gets. And there are lots of resources out there to help you learn how to do Kegels properly. Even physical therapists who specialize in this kind of thing.
Okay, so be proactive. Keep those muscles strong. As we wrap up this deep dive, what would you say is the most important thing for our listener to take away from all of this?
I think the biggest takeaway is to pay attention to your body, be aware of any changes in your urinary habits, and don't hesitate to see a doctor if something seems off. These conditions are often very treatable, especially when caught early.
It's about being your own health advocate, right? And not just suffering in silence.
We got it.
Well, I think we've covered a ton of ground today. We've gone from the basics of urinary retention and BPH to exploring the different treatment options, the potential complications, and even the emotional impact of these conditions. It's been quite a journey.
It really has, and I hope our listener has a much better understanding of these issues now and feels empowered to take control of their urinary health.
Me too. And remember, if this deep dive has sparked your curiosity, don't stop here.
Yeah,
Keep learning, keep asking questions, and keep those conversations going with your healthcare providers.
absolutely. Knowledge is power, especially when it comes to your health. So stay informed, stay curious, and take good care of yourselves.
Couldn't said it better myself. And on that note, we'll wrap up this episode of The Deep Dive. Until next time, keep exploring and keep diving deep.